I'd like to discuss with you some of the frequently asked questions that I received during our first consultation, and I hope that you find this informative and useful during your surgical journey. One of the most common questions that I receive is in relation to the recovery time following bunion surgery. I'd like to walk you through what the rehabilitation looks like following a keyhole bunion correction, so that you have all the information available prior to your upcoming procedure. The procedure is performed as a day procedure, and this ensures that you spend the evening of the procedure at home. You are able to weight bear immediately following the procedure, and we utilise a medical shoe termed a Darko shoe, and you wear this for a period of 3 weeks. Whilst you are weight bearing, the first week or so is really spent trying to reduce the swelling, which ensures that you keep your leg elevated as much of the day as possible. Of course, when you do need to get up and go to the bathroom and make yourself lunch, you can of course walk without the use of crutches or a walking frame, as long as you have your medical shoe on. I will then see you following the procedure somewhere between 2 and 3 weeks, and I do this in conjunction with the nurse at our clinic. We will remove your bandages and ensure that your keyhole portals have all healed. Following this, I will reiterate that your medical shoe stays on for a period of 3 weeks before transitioning into the next phase of the rehabilitation. At the 3-week mark, patients transition into a supportive sneaker. Some of the brands that make a nice supportive sneaker include Asics, Brooks and Hoka. And this ensures that you have adequate protection to the underlying osteotomies while they are healing. Given that the keyhole bunion correction involves repositioning the bones of the big toe, there is a period of time where those bones are going through a healing phase. This usually occurs over a 3.5 to 4 month period. Whilst this is occurring, you will have some localised swelling within the big toe. Another common question that I receive in the clinic is when patients can return to exercise. This really depends as to how high impact the exercise is. Low impact activities such as leisure walking, swimming, elliptical trainer, Pilates and yoga can commence at the 6-week mark. More higher impact activities such as running, jogging or HIIT, gym-based activities, require that bones have completely healed or united, and this takes somewhere between 3 to 4 months. I am frequently asked when patients can return to driving following their keyhole bunion correction. Largely, this is based on whether their left or right foot was operated on and whether their car is an automatic or a manual. It is a legal requirement that whilst you are in the medical shoe, you are unable to drive if this is on your right foot. If you have a manual car, then during that 3-week period whilst your medical shoe is on, either your left or your right foot, you are unable to drive. A key consideration when deciding when to undergo your keyhole bunion correction is how much time off work you may need. There are a number of factors that are taken into account, including the logistics of getting to work, and this may be whether or not you're able to drive during that first 3-week period whilst you still have your medical shoe on. Obviously, what work you do is very important in deciding when you can return. Desk-based roles, I'd typically recommend a 2 to 3 week period to allow you to focus on your foot for both your exercises and reducing any swelling and inflammation. Some of the more manual laborious roles may require up to 6 weeks following the procedure, and I will of course discuss the specifics with you and your role at the time of your consultation. There are some important considerations when deciding whether to have one or both feet performed at the same time. This is a very common question that I receive in the consultation. In general, the advantage of having one foot performed at a time is that the overall recovery is slightly easier. You still have one foot that has not been operated on to help propel yourself around and mobilise. The major advantage of having both feet addressed at the same time is that you don't need to return down the track to undergo further surgery. I will discuss this with you, and there may be some clinical reasons as to why I suggest that one foot is corrected at a time, and this may relate to some underlying soft bone or osteoporosis, or indeed if you require more additional procedures at the time of your keyhole bunion correction, such as correction of adjacent hammertoes. A critical aspect to recovering following bunion surgery is the rehabilitation required. Rehabilitation starts as soon as the procedure is completed, and you will be seen by both myself and a podiatrist on the day of your procedure in hospital. There will be some exercises provided that largely focus on range of motion of your first MTP joint, as well as swelling reduction activities such as elevation and icing through your bandages. We work alongside your regular podiatrist or physiotherapist, and I will provide you with a rehabilitation form that explains exactly what procedure has been performed and the exercises and steps necessary during your rehabilitation. If you do not have a regular physiotherapist or podiatrist, we have an excellent team that we work with that can guide you through the rehabilitation over the first 3-month period. I am frequently asked whether or not bunion deformities can reoccur on their own. The short answer is no. A bunion deformity in its own right will not reoccur following a keyhole bunion correction. However, if there is underlying soft bone or if the screws move at all following your procedure, then this is possible. The risk of this occurring is extremely low and not something that I frequently encounter. I hope that you now have a better understanding of some of the common questions that I receive during our consultation for bunion deformity correction. If, of course, you have any questions that I have not answered, please don't hesitate to contact our administration team. We will be more than happy to guide you through. I look forward to seeing you shortly. Thank you.